Thank you,
Okay.
sir.
Yeah.
Good evening, good afternoon, and good morning. This is the 1587th day of continuous webinar conducted by International for Promoting Homeopathy. Today, our guest is Professor Dr. NIMAI Chandra Dhole. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi, that is from 7:30 to 8:30, and we have an international session from 9:30 to 10:30, and 8:30 to 9:30, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the sessions can join there and thereby watch it again, and you can subscribe the same without paying any money, and you can share it with your friends so that the homeopathy will reach every corner of the world and every household. So let me come to today's session. We all know that today our guest is Professor Nimai Chandra Dhole, who is the principal and HOD, Department of Practice of Medicine, Jim's Homeopathic Medical College Hospital, Hyderabad. Dr. Dhole got a learning opportunity from Dr. S.K. Dubai, Dr. Mohammed Singh, Dr. A.K. Banerjee, like Indian Stalwarts, and joined as a tutor at Father Muller Homeopathic Medical College Hospital in 1998 and completed MD in Organon of Philosophy, and then from 2001 and worked as a professor and PG guide in Department of Practice of Medicine till December 2017 at Father Muller Homeopathic Medical College, Mangalore, under Rajiv Gandhi University of Health and Science, presented 12 scientific papers in national level conferences, published more than 10 articles in different national journals, and invited as a research person by different organizations like Ayush, NRHM, and ROPT program. He was selected as IHMA president in the year 2009 to 2012 in the Mangalore chapter, appointed as UG and PG examiner and paper setter at various universities, Arigius, Goa University, MG University, and Kerala University, etc. He has done research work on paper. He has done research work on platelets, augmented property of Carica papaya folia in healthy human, and effectiveness of Natramo 200, China 30, malaria officials 200 as preventive in malaria, and longitudinal study 2009 to 2016, and joined as Jim's Homeopathic Medical College and Hospital in September 2017 as professor and HOD Practice of Medicine, and appointed as the principal in March 2020 at Jim's Homeopathic Medical College, and is now working as the principal since 2020. And today, Doctor will be discussing about a common respiratory disorder and its homeopathic management. As you all know that this is a big subject, it's a wide subject. This is one of the things that usually affect, particularly during the winter season. It is a very, very good selection by our Professor N.C. Dhole sir. So you can, proudly invite you to take the session, sir.
Thank you so much, sir. Am I audible?
Yes, sir.
Okay. A very good evening to all and Happy New Year. Those who have joined so far with me. Yeah, this is winter is peak now all over India. And there are some part of India, of course, there may not be much winter. So today's topic, actually, what we have selected, the common respiratory disorders and their management. Now, if I say why I have selected this topic, as already you have said rightly, is a very important topic in our practice. If we see the human, our anatomy, that system, how many system we have? CNS, CVS, RS, respiratory system, GI, then we go for locomotor system, and skin, of course, integumentary system. Among all these, the most important, there are two systems, one is respiratory, another one is GI. If you see, these two are very, very vulnerable to get affected. Why? Because we have direct access from the environment. See, the anatomically, the nose, the oral cavity, these two actually we have to use each and every moment. The reason for this particular reason, actually, if you see, most of the children, the moment they are exposed to this, our universe, environment, they are prone to get some infection in their body, because we have to breathe. The moment respiratory system start working, we have to inhale from the environment. Now, if you go back to our ancestors, maybe our grandfather, great-grandfather, those days when there was no much industries, and today there's a big, huge gap. The respiratory affection or infection, whatever you term as these days, the disease burden, it is very, very much increased. Now, I'll just go through the slide. If I just would like to say something like the global burden about this disease condition. So the survey has been shown that the chronic and acute, both the conditions are available in our respiratory disorders as well as like other system. So now this acute, there are certain condition what we usually come across very seasonal sometime. And with that, sometimes people may be in trouble for a long run. If it is like a chronic, it will end up. And some condition actually, it is like a start with the chronicity and they just be lifelong with the people in the throughout the life. Now it has been noticed, the survey is done in India as well as globally, the maximum people who suffer with respiratory illnesses, it's supposed to be the COPD, whereas we get it around 456.5 million cases globally. It has been registered like 2019 data at source. And in that, only COPD has been said it is 80 to 85%, 82% cases. And the death of per year, it happened around 3 to 3.5 million per year. So it's quite huge if you see that. And if you see that the factors are responsible for the region-based specific variation like air pollution, comorbidities, and there are two kind of things. As I said you before only, that the pollution is one area and the comorbidities, because the lifestyle, the disease, how we allow them to enter in our body, of course, we are responsible. I always say here in my student also, our health is our hand. The way we manage ourselves, we will be getting the disease or preventing the disease. That, of course, is a very important thing. We should know that. There are two kind of disease prevail. Some disease condition usually we notice in the city areas or the urban areas, and some condition will be seeing in the rural areas or the village areas. So mostly if you see that the air pollution, which is more common in city areas, big metropolitan cities, and of course now we are seeing the urbanization is very rapidly growing in our country. And the comorbidities, of course, it is seen the lifestyle disorders. And one more thing is that till these days also, we can see that the village areas, the people, they use the firewoods, the kerosene, and some other fuels, which could be even domestic, you can say that the pollution, which is affecting these particular days even the female, the mothers, those who are cooking food also. It was not like earlier those days, but these days it has been increasing. It has been registered scientifically. There are some disease conditions, what you see, like bronchial asthma, COPD, upper respiratory infection, tuberculosis. It varies with the seasonal sometime. Okay. So if you see the 31 to 32% in autumn, that asthma increases, that you all experience, whereas it decline in the summer season. Similar way, if you see the COPD, chronic obstructive pulmonary disease, which has been more prevalent in the winter season, and again it is very drastically come down to summer season. Whereas upper respiratory infection, which may be in the winter more, again similar way, it is less in the summer. And tuberculosis, which supposed to be it is a hub. India is the hub. We said that our country is a hub for tuberculosis. And the reason could be the way we deal our life, the way we maintain our hygiene, that it plays a big role for tuberculosis, because it is a droplet infection, and we knowingly or unknowingly, I know you'd be like spitting here and there, and sneeze, cough, without highly density population in our country, and where the people are very much exposed very easily for this kind of droplet infections. That also in the autumn. So if you see literally the summer season where it is dipping, that respiratory symptoms, whereas the winter and autumn, these two seasons we get it more. Now, if you see the anatomical distribution in our body, the respiratory system, how it is distributed. The upper respiratory tract, we all know that it usually distributed from nasal cavity till our larynx. Okay. So if you see this particular what we have displayed in this our slides, the nasal cavity, the pharynx, the larynx, this actually till this much we call as the upper respiratory. And most of the time, the acute illnesses of the respiratory system, it hover in this particular area. Most of us suffers allergic rhinitis. Sometimes we blame the season. What do you say? Weather change. And right now, sometimes our student, they fall sick. I said, what happened? Sir, weather change. So if you see this, actually, we just blame weather. Of course, it's part of this, because of suddenly there will be dipping of temperature, suddenly there will be temperature will increase. With this, our body may not be able to acclimatize properly. So that, and of course, the pollution also will be increasing and decreasing as per the environmental condition. So if you see the daily weather now, there is a fog, the oxygen dip down, the index of the quality of the air, that bad weather, we say that it increases. So that all this matter, particularly in the polluted cities. And that a trivial symptom like a common cold, allergic, sinusitis, till that pharyngitis, tonsillitis, it can go till laryngitis, epiglottitis, and the croup. There are some conditions are very commonly seen, like allergic rhinitis, sinusitis, and common cold. Whereas some conditions like a lower respiratory tract, what we termed as, it is mostly the lung itself, where some more deeper structure we get in this affected. The acute complaint, what we experience, that might land up after some days of, if it is not treated well, and if the person is low vital, homeopathic subject, you call as low vitality or low immunity, low like susceptibility is high, they must be sometime getting this very frequently, as we all come across those who are practicing homeopathy. So now, anatomically, if you see, there are some mucous membrane, that the epithelium we will be getting in this, the structural, and there will be cartilage till the bronchial, here the major bronchus. After that, in this bronchial tree, there is no cartilage, and we'll be having a lot of mucus gland that secretes the goblet cells are there. So there will be a secretion. The goblet cell just gets stimulated and secretes. So the allergen when they enter in our respiratory tract usually is like a foreign bodies. So this mucous membrane, they are very much sensitive. They try to throw it out. So we sneeze, we cough. Any foreign bodies are not allowed in our system. So it is a defensive mechanism, the body, it try to protect ourselves. So that would happen. But still, if there is a lot of things are there together, some portion it goes inside and ultimately we inhale it and it go and land to the respiratory tract down to the lung. And you know that the bronchus, and the bronchiole, and the tertiary bronchiole, then it goes to the alveolar sacs, then alveoli. So that is actually the respiratory because a tree. So it goes deep down and ultimately some inflammatory condition happen and we react accordingly and different kind of disease condition develop. So you all know this, so I need not talk much about this. It's the tracheitis, tracheal bronchitis, acute bronchitis. Like according to the anatomy, that the itis. So you got a symptom, sorry, disease condition name, it comes out. So in this, there are something which are very much dangerous, or sometimes it will be prevailed, and we need not, unless we take the treatment properly, we may land up some chronicity and ultimately some structural changes happen in our lungs. In that, some disease, as you said, that the acute may in the alveoli, you might get the pneumonia, pulmonary edema, sarcoidosis, ARDS, or the lung, sometimes COPD, tuberculosis, lung cancer, pulmonary fibrosis, and some condition we get the vascular condition like pulmonary embolism. Here we get in the bronchiolitis, asthma, chronic bronchitis, bronchiectasis, cystic fibrosis, different names are there. We have the lung outer covering is there to lung to protect. There is the pleural cavity. We have two layers, visceral layer and the parietal layer. In that also sometimes this particular part of the in between these pleural two layers, it should be very sterile. It should not be, nothing should enter. Only a very minimal 30 to 20 to 30 ml of fluid will be there to act as a buffer or cushion. Okay. So this is actually like a very like a protective mechanism. The lungs should not get hurt. So that it is kept and lungs should expand nicely to get the air inside that way. But if something happened in this particular sterile place, the fluid enter more due to some irritants or if air enter more, so we call it as pneumothorax if it is air, if it is a fluid, we call it effusion, if it is pus, we call it as empyema. And sometimes simply, if it is inflammatory condition, we call it as pleuritis, and some tumor develop, mesothelioma sometimes. So these are the different way actually our this particular part of our lung outer covering can sometimes get diseased. For that also we have some medicine that we'll discuss later. Based on pathology, we know that we have some virus, some bacteria, some fungus, and sometimes some other obstructive condition. As I said already, COPD, bronchial asthma, bronchiectasis comes. Some are restrictive, some are obstructive. I'll just tell you, this is obstructive, these 3-4 conditions are there. And if it is a parenchymal disease, ILD, fibrosis, and sometimes GBS like Guillain-Barré syndrome, and some sclerotic condition, chest wall deformities can also anatomically, if it is deformed, can cause restrictive pathologies. And some tumor like bronchogenic carcinoma and some other cancer can manifest in the lung, can cause also lung disease condition. So this is obstructive restrictive malignancy. What are the causes and triggering factors that can lead to our infective illnesses are there? I told you viral already. In brief, if you call as what causes the respiratory illnesses. One is environmental factors. If you see the air pollution, occupation, exposure to pollution, and extreme weather condition, of course, I discussed the lifestyle, smoking, obesity. These days, obesity is one important factor, and smoking. School children also, we could come across that they started smoking. So the disease condition are very much mixed type these days, very early ages, itself, we are experiencing the patient come to us with that very early age. Earlier, the COPD is supposed to be the 50 plus age group. Now 30 plus, they are landing up with the COPD condition. The reason is that early smoking, or maybe the residing where the pollution is very common. So this is actually one setup of triggering factors. And otherwise, you already discussed that the pathogens, already I told, and allergens like pollen, dust, mites, mold, pet denders. I have come across many conditions where particular, one patient was in Canada, they used to tell that this particular time when the ice, snow melt and some flower blooms, and we get some problems. So it is actually those countries very commonly seen, because they will be having some particular winter season for long days. There won't be much, what do you call it, only snow. They hardly get, what do you call it, this, flowers and all. Whereas in our country, different season, different pollens and different kind of, what do you call it, the flowers, it blooms. So usually we get exposed, some may get, some may not get. Here again, homeopathy talks about that susceptibility. We'll talk later on. So some dust, mites, mold, pet denders that you all come across in our daily life. This one set. And other set is like something called genetic and biological factors, where you see that the alpha-1 antitrypsin deficiency. There we get some condition like emphysema is one of the important factors for that, to this condition. Cystic fibrosis is another genetic factor where some people experience this. And of course, immune deficiency, that is HIV or AIDS, when it goes in children. Psychological factors, sometimes we may not give much importance. I have come across in my practice some student, sometime very young student, they just come and just sometimes they're stressed and they just cough, and the cough doesn't go. Just they found out some factors, and they have come across many all ample of investigation is done, everything is normal. Then ultimately we just discovered that they have some anxiety or stress, which gives them very much impact in their life, because how do they handle their life with that? So I'll talk, when I talk to the management, I'll come across this. Now, all those things I have just briefed so far, that what are the condition can cause our disease, like how we can experience the disease, what are the pathogens, what are the different factors. Now, when the patient come to us, they just come with some symptoms. Some come with a cough, some come with the running nose, some sneezing, or some may be having breathing difficulties, or some may be having chest pain. In that, most commonly what you see is cough and dyspnea or breathing difficulties, or sometimes some people come with chronic, it is like increasing their symptoms. It started some months back or year back, and they are just landing up with chronicity. Now, whatever the symptoms comes, they present us, we need to very well take up the case, to diagnose the case first, as diagnosis is very important to know the prognosis of the disease. We know every system has limitation, including homeopathy. We also should understand that what we can do, what we cannot do, how we can manage the case, how we should give them the management, general management, as well as the medical management. We should know the which age group. As I said at the beginning itself, the day one itself can patient come up with some sorts of respiratory symptom. If I'm not wrong, I recently, and my family only know that is a newborn has come, and I was, of course, I'm in Hyderabad, they're in Kolkata. So they say me that there are some medicine has given prescribed on the day of discharge. I was just wondering how it is possible. The child is born only 4 days, and they have discharged the mother and the child, the baby, with some medicine where they have added some nasal drop. Is it necessary? That's a question for us. I'll come all those things when we discuss the management. So that's what I'm telling, that age is very important to know that which age group we are handling. So these days, it is like a very early age, we get some symptoms, whereas middle age, some of the symptoms and signs, and some other we get in the elderly age group. So geriatric people, they come up with some sorts of symptoms, whereas very teenage or very early age, not even teen, that just we call toddler, school going, preschool going, they get some symptoms. So age group is an important thing to register properly, and where they reside. Because we come across frequently that medicine is well selected, is given, but still it doesn't work. We have to go back that maintaining cause, what Hahnemann has clearly explained in his organ of medicine, where you know that there are some maintaining causes are there, the patient is residing in such a place, then nearby there is some factories are there, or they will be working in such an environment where they so much pollutant they just engulf daily. So if it is like that, so in that case, unless they are taken out from those areas, they won't be able to cure. We can't cure them. Then presenting history, we know it is a part of course, case taking, but we need to properly take the case so that our symptoms will be well registered, and the common symptom, unless you know, we cannot find the uncommon peculiar symptom where our business is more than that. So onset, duration, the progress, how it is, the first progress in disease, we need to manage well. And for the acute disease, the modifying factors are very important. And treatment history is another thing. Some medicine can itself cause the respiratory illnesses, the cough and some condition. So we should have proper way of dealing them. So you know, acute some conditions like bronchitis and UTI, asthma, of course, allergic asthma also is there. The acute condition, you know, and progressive illnesses like gradual progression is there. It may be worsening slowly, like COPD, fibrotic changes and things. Traveling history and some infection if it has happened recently. Family history of tuberculosis. I usually come across somebody is there in the family member who is affected with the tuberculosis. They are not well taken care, not using masks. A mask is not used, and they are just sneezing, coughing, mostly coughing with the family member they're residing. And ultimately, the other family member, they get exposed. So in the initial stage, they may not know that they have tuberculosis. So already they must have given to their family members. So that would happen. Personal history, of course, smoking, and sometimes it happens smoking direct and indirect. I'm not a smoker, but my fellow who is smoking and I'm getting exposed, I may get also equally. And of course, the emotional disturbances triggering factor could be. So usual symptoms, already I discussed that cough, with or without expectoration, shortness of breath, chest pain, wheeze, hemoptysis, headache, and sometimes some consistent symptom. With that, you may get fever, malaise, body pain with that acute condition. This is in the book itself. Those who are recently passed out, they can remember it, and those who have passed out long back, they can, of course, very well remember it because it's all starting from different areas. You can just make out this. Even though the symptoms, respiratory system, that can even affect the other system also. Like respiratory to cardiac, we call as cor pulmonale. There we may get sometime edema also. So we may get for that some auscultation findings, some percussion findings. Okay, even the clubbing comes for these conditions like lung abscess, bronchiectasis, long-standing tuberculosis, bronchogenic carcinoma. So the system, when you just examination we do, that's why always I tell my student, that it starts like when the patient enter in your clinic. You have to look how they work, how they sit, how they talk, how they, in between they take a deep sigh, they cough, they panting for breath. You look at the hand, the clubbing is there or not, or they are cyanotic or not, the face, how they look, everything matters. So it will be helpful for your diagnosis as well as managing them, whether you should admit them, they need immediate care, they need a referral, things are required. Otherwise, every patient we cannot just treat OPD basis. So this is a very, very important thing. OPD basis, what we can handle, we should do it. Otherwise, we should just give them to hand over to the other measurement where is oxygen is required for them to be sent. Now, cough, very, very irritating things, and most of us will be getting this very frequently. And if I say that, I have come across in my so far 27 years experience of practicing, I have seen that. I have a patient who has come from allopathy family background, and they could not cure the cough. They have given bottle of cough syrup. They themselves told that they have given a lot of cough syrup, but still we are not getting the relief. Doctor, to do something. I just examine the patient, just open the mouth and just check that there is a uvula is very much elongated, enlarged uvula, and the touching, and it is irritating, and there is cough. I hope you medicine, you have already discovered the medicine. So I will not tell the medicine name. And I have given that, of course, calibicromicum, 200, 2 doses. And that patient, after 15 days, they say that 80% better. So this is actually how the patient, we miss sometimes, because the cough, nothing, only this uvula, everything is normal. Chest is normal, everything is fine, no nasal discharge, but uvula is elongated for that. Similar way, I had a patient who had come across with the cough after eating food, like heavy meal, and most of the night time when they go for bed, and just I discover it, they have taken similar way, they have taken many medicine, everything is fine, everything is done, just X-ray, big thing is done. And simple thing for we miss sometime, patient had GERD, gastroesophageal reflux disease. So what is happening? They eat so much and it comes and just irritate the upper respiratory tract and they get cough. I have just treated only GERD and given some measurement how to manage GERD, and they just get rid of the cough. So this is how, very simple thing, but irritating thing. They can't just do their work, daily work. So it is all very trivial thing, not dangerous for the life, but still is a symptom. And many pulmonologists also sometimes they just think how to manage it. We must missed. I'm not with due respect for everyone telling that. It is required some time to know that very simply we can just some condition we can treat. Now you see that area-wise, the postnasal drip is very common condition where the pharynx get congested, and sometimes chronic pharyngitis and follicular pharyngitis we have just come across. Many drugs are there in repertoire and mathematic also. Laryngitis, of course, we can know that. Whooping cough also, many drugs are there. Then you go for drugs, some side effects are there. There are some drugs, AC inhibitors, okay, that very frequently we have just know that allopathy, they have to treat some condition like AC inhibitors, these are having hypertension, and they just use this drug and they just explain the cough. And that case, if you stop the medicine, the cough will go automatically. And this is the condition where this some sputum. We ask the patient how is the sputum, because with that we diagnose the case. Whether it's a mucoid sputum, whether it's a watery, whether it's a frothy, whether it's a pink frothy, whether it is a whitish, whether it's smoky, or it is what do you call as offensive, non-offensive, blood stained. So this all gives a diagnostic purpose. Sometimes it is infective. We come to know by seeing the sputum character. So we don't do business much with this because we have ample of drugs which is very close to this, like color of sputum that you all know. But for the diagnostic purpose, you know that in some time what happened, some patient they may complicate. In that case, sometimes if required, we need to take help of our allopathic physician. We should not be simply stubborn that we can treat every case, because if it is complicated, sometimes lung, of course, is a vital organ, you know very well. So we should not give chance. If there is a lung abscess, it may turn out some big lung condition, lung pathology. There we may leave the, we may have to pay the big cost. So be careful when you treat that infection. If it is very much loaded in the lung, in our body, we need not think to take help our fellow system. This all you know that I already discussed that. Different color of sputum, sometimes aspergillosis, of course, aspergilloma is a black sputum we get, and green, already told you, viral and other condition. Cardiovascular condition like if there is a pulmonary edema, also you get a cough, and respiratory already told. We will discuss all those things. Now, dyspnea, one condition where you see that. I think this dyspnea only you want to discuss it, but it is a part of this. Dyspnea actually is very important thing because there are two origin. One is respiratory, another is cardiovascular, and there are some other condition also, metabolic acidosis and uremic condition, lung condition, psychogenic condition, many things are there. But you should not miss it. My point is to discuss today is that there are ample of condition will get where acute asthma is very common condition, COPD, pneumothorax, pneumonia, pulmonary embolism, then lung collapse, okay. Foreign body inhalation in case of children, of course. But there are certain things, maybe life in danger, and there's something maybe chronic condition. So both the things we should be able to diagnose properly before you take up the case. Very important because lung condition, heart condition, if condition is there, the heart affected, we need to take some time indicative treatment, like allopathy, homeopathy. Together we can practice. There is no issue in that. Okay, only we can do it. There are many conditions where we need to just go for palliative also, because what is the permanent changes are there. As Hahnemann says rightly, we cannot just permanent changes. We can reverse it back. So irreversible condition, we should know first what patient we're handling, whether the patient is having reversible or irreversible condition. If it is reversible, very well we can take up. It is irreversible, we need to give due respect, and step by step we should treat the patient. This is already I have spoken that, and we need to rush through. But time is, I think, short a little bit. Okay, so this is like chest pain also one part of this. Most important chest pain condition, you know, the angina, MI, pericarditis, aortic dissection. This is cardiovascular, and whereas the some respiratory condition where we get pleuritic pain, which is very like sharp shooting pain. That is, if it is a pleura is involved, those condition usually is come across as kind of pain. But GERD also can give this, and sometimes some musculoskeletal condition also can give this a pain. But any pain, any chest pain, what I learned from my teacher, as a teacher also, I always tell my student, don't neglect any kind of chest pain. It may be musculoskeletal, it may be psychogenic also, but still you should go through the investigation, especially after COVID. It is become very much mandatory to take care of this particular condition, because chest pain can land up any kind of big thing also. So we can very well go through that cardiac marker, which is very these days now, any kind of lab is available these days. So we can just go through this cardiac marker as well as one ECG, and with the what you call as treadmill TMT also these days, to be very important. Hemoptysis, another important thing. Sometimes we need to know that the condition where hemoptysis, lung cancer, bronchiectasis, and bronchial edema, foreign bodies also can cause tuberculosis. Another important thing where you get the sputum with red sputum with blood sputum. Now, whether every case we can take up. We have many very good medicines there like Acalapa indica. We see that phosphorus, sometimes calico, sometimes ipecac, okay, and a lot of medicines are there. But every hemoptysis we should not take up. The simple reason is that we should know the cause first, because many causes are there where we cough out blood. If it is a massive bleeding, sometimes they'll end up with major condition. So be careful. We have some medicine, we can treat it. I don't say no, but as a medicine person, I'm a medicine department person, so I'm telling always that please go for diagnosis, see the diagnosis, whatever list is given, that anything can come and this. So which one is treatable in our domain, we can treat it. And side by side, there is required is a massive hemorrhage. homeopathy cannot arrest it sometimes, not always until that. So we need to go for some other help which can arrest the bleeding. Sometimes we give medicine, like allopathy medicine is going on, like ecosprin, some blood thinner. So that also can come up with many kind of bleeding tendency. We should know that. So that is why drug history is very important. So if you stop that, so it will come down. So you should know this. This is one thing I've taken from the book only, Davidson. So there are some conditions where we get these actually give this picture. Any student, if they have joined this seminar, the webinar, they can just find out that it's very important to diagnose at a glance. Like there are clinical condition and there are some parameters are there, like what happened in the bedside, how we can diagnose the case. Okay, just by seeing the displacement, percussion note, breath sound, vocal, and with this we can very well diagnose this list of cases. Telling you. So in case of pneumonia, consolidation, collapse, then peripheral bronchial collapse or collapse, then fibrosis and pleural effusion, emphysema, chronic bronchitis. Then we come across like bronchopneumonia, then pulmonary, other pleural condition, interstitial lung disease. So there are some conditions where the medicine will be shifting, medicine will be opposite side, will be same side, like a fibrosis and collapse on the same side. So if we percuss, we'll come to know. If we just breath sound, if we hear, we can get to know that the bronchial breath sound, or it is a normal vesicular breath sound, or it is a very vesicular breath sound, prolonged expiration. So this thing actually gives us some sorts of clues in the bedside itself. And after that, we can give the diagnostic for the tool. We can send for the either chest X-ray, or some people you can send for the pulmonary function test. Some will send for the HRCT, like so that we'll come to know exact what is the cause, and accordingly we should treat the patient. Because management depend on these days, the diagnosis is very, very important, because patient need some supportive thing also. This is actual diagnostic tool, the very common thing like a complete blood picture, to that the CRP, like these days after COVID, it is mostly CRP is raised for almost all inflammatory condition. Then ESR, of course, in chronic condition, you see chest X-ray, then CT scan of the chest as well as the HRCT, then sputum, especially for the tuberculosis, sputum culture and the ABTS is required. Then allergy for the, we go for the skin prick test, and biopsy for some dangerous condition, like we go for when you think of carcinoma condition. So this is the diagnostic tool. We can just, they give the different kind of condition. And for safety measure, general management, if we come to this, we usually use the mask and sanitization. Of course, for some kit is available these days, we can just use it when you go for the crowded places, or if the person is already having some underlying factors, like if they have comorbidities, we usually tell them not to venture where there a lot of crowd is there. So because simply they go and they get into trouble by inhaling lot of virus or bacteria, and when they come back home after 2 days or the next day itself, they will be experiencing some sorts of, like mostly pneumonia and some conditions. Okay, and to avoid that, we give some safety measure, like, and if some people are having these like sinusitis like feature, we give them steam inhalation. Usually they get relief. And what are the triggering factors if there? We just tell them not to get exposed. They can very well get it. Now, homeopathy scope, if you say that, I say it's a very, very good scope is there, as if you can give some sorts of general management. Along with that, you give homeopathy medicine, we can do the miracle. We can do the miracle, especially the allergic condition where other school, they have some anti-allergens, you know that, antihistaminic. And with that, that is a temporarism, they give relief, but that gives in long run sometimes some complication also. So in that case, we have very, very good medicines. So in that repertorization, we do case taking, we do, and go for repertorization, we can find out some medicine. With that, very well we can, acute way, we can measure it. So as Hahnemann said that we need to understand the pathology first, causative organism, and accordingly we should just make it. Now thing is that we reside some places, the flower will be blooming. We need not just go away from them. Same time, we will be staying there, but we should be able to inhale that. So for that, we need to get some medicine. So this allergic condition, asthmatic condition, what we usually come across, we need to understand that. And our medicines are there in the repertory. We can very well small case taking the triggering factor. In case of acute disease, what you see in acute disease, we will be getting cause, elements from, and the modifying factor. These two things, if we just know properly, we can treat ample conditions of acute disease. The chronic condition, we need to have the other factors, contributing factor, the person as a person, then we can just make it. So starting from A to Z, I can tell that. So aconite, you know that the aconite, which is being used very, I think if I am not wrong, the aconite is taken by my guru, Dr. S.K. Dubeji. So in the first year only he has taken this drug, and in Calcutta Medical College. So he was teaching that aconite is the medicine for doctor. He told this first sentence, aconite is the medicine for doctor. Then he was wondering why it is called doctor medicine. Then when will can prescribe for the patient? So he just very nicely explained that because it is given in illness code itself before localization takes place. This medicine has been used. Then when you read this drug properly, then you came to know that because it is like a very first stage of the disease. And only the doctor can realize that. The patient, when they land up to us, already some hours are over, maybe 12 hours something. By that time, usually the aconite stage goes for the respiratory system. That's what I'm telling that. Rightly, my Guru just said that it is a doctor, medicine for the doctor. But still, at least the doctor, they can change their, they can treat for their very close people. They just come, or the patient who comes very first, they can land up to us. We can treat them very well. And the cough, these are dry, hacking cough and exposed to draft of weather, draft of air. That is the aconite very much indication for the acute condition of this, especially the cough. Allium cepa for the coryza, allium cepa euphrasia is the medicine for the coryza. Some are bland coryza, some are what do you call as acrid coryza. But the dalcamar is another medicine. But the cold settle in the eyes. It is given. Boric is given. Cold settle in the eyes. Medicine is dalcamara. When the sneezing is there, in the warm room it is aggravated, we go for allium cepa. Okay, open air aggravation, we go, and the warm room amelioration, we go for arsenic. So this is the medicine actually, it's a keynote like you can think of, some medicine. That is, those who are doctors, they already know this, and I don't say much. So, coryza with headache is a very important drug is allium cepa, dalcamara, they come very close. And if it is a nose block with this one, coryza, arsenic album comes, aram triphylium has come in this kind of condition. So is acute. This sometimes sabadilla is a sneezing remedy. We know this. So this is a very good remedy for usually we come with acute condition. There are some drug called COPD like what the collection is very tough, stingy. There's anti-intert where you get the rattling kind of condition and death rattling that is given very well. Carbovage, some drugs are there, and the arsenic, of course, Cali curve, some drugs are there. You know very well. Bronchiectasis, another medicine. Some medicines will come for bronchiectasis like natrum salve, Cali group, Cali curve, and pneumonia also used. Our medicine is used like a antidote for pneumonia. Very well it has been used for this to handle the acute condition and the chronic condition. Both we can use this drug. Arsenic is a master type of bronchial asthma. allergic bronchial asthma. I can tell you those who are residing in the seashore. When I have resided 19.5 years in seashore, Mangalore. So I know that my allergy is to go so high.
So, is there any network problem with you?
I'm using arsenic much. For me now, I get sometime, if at all I get, I must, am I audible?
Yes, sir. In between, there was a problem for half minute, and now it is okay. Sir, only 6 minutes remaining. Shall we go for the discussion, or we can have a second session for mathematical session? Can you hear me, sir?
Range problem.
Yes, anyway, as we all know that the respiratory disorders are one of the commonest problem in this winter season as well as summer season. We need to find solutions to all. Homeopathy has a solution in all kind of diseases, whether it is a acute illness or a chronic illness, as far as the upper respiratory infections are concerned. As we all know that at the time of COVID, a lot of people are coming with these respiratory distresses, and there was a big complication afterwards after using the allopathic medicines, particularly allopathic medicine. People suffered a lot out of it, and been a lot of people got complications in the way of diabetes mellitus and so and so. A lot of people have problems in the lungs. All this can be cleared with homeopathic medicine if proper medication is given by a homeopath. If the person made a visit to homeopathic doctor, definitely we can do wonders. In that case, the case is supposed to be incurable, can be cured on that way also. This is anyway. Today's discussion was about acute management of all these things, but unfortunately, our guest just come up with the causes, different differentiation, different diagnosis, and all those things. But the treatment part was not little bit short. And actually, in this kind of promotional program, we need a case presentation to show the world that homeopathy is doing such wonders in those conditions which are supposed to be incurable. Hope still our guest has lost his connection and may be trying to join. But as the time is short, I am inviting Dr. Hariharan sir to say a few words on this presentation, as well as. Please unmute, sir.
Hello, sir. Today this presentation is very informative, and this the pros and cons and the diagnosis and all very well doctor described. Anyway, my comment is limited, and one thing I like to say is that all the reasons he narrated, except see in my notice that see suppression of certain diseases, especially autoimmune diseases, that respiratory symptoms will arise. So we must address that part also.
Yes, sir. Mr. has joined.
Hello. Sir, am I audible now?
Hello.
Yes, sir.
I'm sorry, sir. Actually, it was just
No, it was a network problem, sir. It is common with all presentation. It is not in our hand. All these technicalities are with.
Yes, sir. I just could not talk much about the incurable cases. I have definitely some cases with me.
Yes,
just
sir.
to share with you.
Sir.
Yes, definitely. We can have another session for case presentation, so that that we can take homeopathy to public people also, because they need to know what is happening with the homeopathy in those conditions which are supposed to be incurable. I invite Dr. Sunil Raj to say a vote of thanks to the session, sir.
Wonderful. Good evening to you all. Very good presentation from Dr. NIMAI Chandra Dhole, Principal and HOD of James Medical College, Hyderabad. A very good, very informative session. So you have gone through all the pathological conditions and all the different aspects of respiratory symptoms. So we want the case presentation also from your side, sir. So I think you will join another session also to deal with the treatment part of the respiratory complaints. Thank you, sir. On behalf of IFPH, thank you, sir.
Yes, Professor Dr. N.C. Dhole, you can speak for it, sir.
Hello.
Yes, sir, we can hear you.
Yes, sir, because I'm just getting difficulties to connect. Sometimes problems happening. Yes, sir. Last part I could not get actually when sir was speaking.
He was saying vote of thanks to the session, sir. You can.
Okay, thank you so much, sir. I think I have.
We are waiting for a session of homeopathic treatment part also from your side.
Sir, definitely, sir. You just give me arrange a session. Definitely, I'll do it because I have many cases to. Because I can tell you honestly, because I have my own relative who has suffered the lung problem, and I could see them. I just lost them. Okay, so that made me actually to learn more or to take more interest about this particular topic. And in fact, I'm doing in my hospital here also some research in my PGs with a lot of respiratory cases. Okay,
Yes.
so I just I can share it very well with you all. So if you give me time, some other session, you can just give me. I can very well explain the cases. That can be exclusively for the case what I am doing here, and I can just be reached to you all.
Yes, sir. Thank you very much, sir, for your excellent presentation this evening. And thank you, all those who participate in the session. Tomorrow, we will have a session from Dr. Vishali Saraswat. And she will be talking about importance of dreams in homeopathy. So that will be a very good subject tomorrow also. I hope all of you will join us tomorrow.